In 2022, the organization Healthy Initiatives sticked to advancing its mission, that is promoting public health with a heavy focus on non-communicable diseases, targeting the risk factors like smoking combustible cigarettes and alcohol prevention in the former Soviet Union. With the help of the Foundation for a Smoke-Free World, we managed to implement two amazing researches in the frames of our project targeted at preventing smoking. Smoking cessation programs in our region, in the region of the former Soviet Union, are non-existent. The two surveys we did in the projects of the Healthy Initiatives was in 2021 and in late 2022 to identify what's the perception of the public of the harm reduction strategy and harm reduction products, and also whether chain smokers can get help if they are willing to quit. The answers and the results were staggering. None of the smokers willing to quit could get help from a doctor. All of them tried to use their willpower in their attempts to quit, the so-called method of cold turkey, which, needless to say, was ineffective. We tried to identify the potential impact of electronic cigarettes on death toll of cigarette smoking. That was the research that we did in Ukraine, in Georgia, in Russia, and actually now we are expanding it to four more countries of the region. The team of experts built a dynamic population simulation model, and their findings were very impressive and also very inspiring. First of all, according to the estimates of the Healthy Initiative, 4,000 people in Georgia and 62,000 people in Ukraine died prematurely due to smoking combustible cigarettes. Our findings suggest that electronic cigarettes have a great potential in reducing smoking prevalence and smoking death toll. The second vector that the Healthy Initiative has been working on was the issue of illicit trade. The region, especially countries like Ukraine, Georgia, are very vulnerable to this combustible cigarettes illicit trades, especially Georgia right now, because lots of territories of Georgia are controlled by Russia, which means are not controlled by Georgia, by the government. Before the war, Ukraine experienced the same situation, which is why the issue of cigarettes illicit trade was skyrocketing, and the government had to respond. So the organization Healthy Initiative managed to build a wonderful team of stakeholders who drew the public attention to the issue of smuggling, of cigarettes illicit trade, and actually worked on developing a draft roadmap on combating illicit trade in Ukraine. And that was done for the first time in the history of the country. All the stakeholders were involved: government, scientists, doctors, economists, even the custom officials. And that was a big deal. We were very proud of that. Then the same thing was done in Georgia. Our organization, Healthy Initiative, did a research to estimate the size of the illicit trade in Georgia and to actually prove whether the illicit trade of cigarettes, combustible cigarettes, influences a death toll, whether it has an impact on smoking prevalence, as many of tobacco control advocates state, whether it has an impact on the state revenues and on the taxation. It turned out that illicit trade is not a key driver in smoking prevalence. It's important, but it's not crucial. It also turned out that smokers' income in Georgia went up. The market, the Georgian market offers legal, cheap, combustible products. For instance, the rolled cigarettes, the self-made cigarettes, which are very popular. And usually the lower economy is in the country, the wider this market of rolled or self-made, as called, cigarettes. And that's what happened in Georgia as well. The bottom line and the goal of our organization is to make sure that as many adult chain smokers as possible can quit or make healthier choices and switch if they cannot quit.